Episode 179 of the Interpretation Station is called to order. Welcome, ladies and gentlemen. How are we all doing? Today is the 18th of June, 2023. Summer holidays are approaching. I've only got 2 more weeks to hold on for. There's light at the end of the tunnel, as we say. A very special episode for you today. So it's for my French-speaking interpreters with French in their combination. I've had a tough day today. My son's birthday party was this morning. Lots of screaming. They're not quite teenagers. They're all about 10, 11. Dear oh dear. They're all right. We took them 10-pin bowling. It was like a scene from The Big Lebowski. Is that the film where they all do the 10-pin bowling? Is that the one? Or is it Dumber and Dumber? I can't remember now. Anyway, here we are in the evening, and I thought I'd do something constructive to finish the day with. So what I've got for you here, it's you may recall a couple of weeks ago I did an episode for my Spanish speakers with some text that I had purloined. Yeah, look that word up. Probably won't need to use it in the booth. I purloined anyway from the World Health Organization during the WHO World Health Assembly. Now, if you want to get a bit of background, get a feel for the kind of text I'm doing, maybe you want to watch that episode first, okay, because I'm not going to go over the background again. There's sort of various vaccines that are mentioned, various initiatives, and I touch on them in more detail in that Spanish episode. So really, if you've got Spanish in your combination, I would advise you to do that Spanish one first. If you don't have Spanish in your combination, well, you'll be all right. You'll be all right. I'll do my best to explain what's going on. And so yeah, who have we got today? We've got a handful of texts. We've got Burkina Faso. We've got Niger. Couple of times Niger, perhaps, is it? We've got Mauritania. Okay, and we've got Monaco. Okay, so some different parts of the French-speaking world. We've got everywhere from Western Europe to West Africa, North Africa. So we sort of cover quite a broad spectrum of different French statements. I'll try and find the recording. I'll certainly put the transcripts up, link to the transcripts, and I will try and hunt down the recordings from the WHO website. And so let's get going. Before you go any further, actually, like, share, subscribe, keep on supporting the Interpretation Station. That's all I ask in terms of your support. Just like liking and giving me comments. Pretty please. Give me comments, right? And find me on LinkedIn if you will perhaps know about. It's been very well known across all media that Roland Pallerat was having trouble with LinkedIn. So if you've lost your connection with me, I'm still there. Find me again, okay? Roland Pallerat. Find me on LinkedIn, and let's get cracking. Okay, so we're gonna start. So as in with the one like we had in the Spanish, we took the statements from 2 different meetings. One was specifically devoted to polio, and the other meeting was devoted more to UHC, Universal Healthcare coverage. Was the C coverage? Perhaps. Okay, so same again here in the French. So we'll start with the statements that were on polio. So the first up was, of course, Burkina Faso. I'll get my little pen out so I can draw. Don't forget, if you're new to this, l'OMS, WHO, that's an acronym. So that's one of the acronyms. The French, obviously, the French aren't as bigger users of acronyms as we English speakers, but yeah, they use the OMS. This is the World Health Assembly, the WHA, it can be referred to. Okay, so let's go. Madam Chair, I think we established that there was a chair at this meeting. Distinguished delegates, Burkina Faso is honoured to deliver, we don't pronounce statements, okay, to deliver on behalf of the 47 members of the WHO African region, this statement au titre du point 15.4 under item 15.4 on polio. I don't think we need to say in English poliomyelitis, I just call it polio. Madam Chair, distinguished delegates, the African region commends, congratulates the Director General. Remember, the WHO has a DG, Director General. It's the Ethiopian gentleman, No, I can't. No, what's the Tedros, right? Tedros. They'll know him as Tedros, and his team for their excellent preparations for the 66th World Health Assembly. Il salue la qualité des deux rapports soumis à l'examen. I mean, you could go word for word. You could say, yeah, welcomes the high quality. Always tend to throw in the high when I talk the quality. Welcomes the high quality of the two reports before us, soumis à l'examen, for our consideration. You can say the two reports for our consideration, or just before us. Again, you don't need to be so literal. And the updates on the relevant information on polio. Maybe you know that's a very French way of saying this. Welcomes the high quality. Salue la qualité des deux rapports. I think in English, perhaps English speaker might say welcomes the two excellent reports before us. So you can. I've always gone for the first one. I tend to just find it easier to follow the word order. Welcomes the high quality. But again, perhaps I think an English speaker would say welcomes the two excellent reports. So I think you can go either way. I might start doing the other. I might start trying to use the English version. The African region, which was certified free of poliovirus sauvage is wild polio. Okay, that was the original form of polio, I guess. Wild polio in 2020 has set as its goal stopping the transmission of all kinds of polio between now and 2023, or arrêter la transmission, a word they were using a lot in the Spanish. I noticed it seemed to be a popular English solution. It's interrupting transmission. Okay, interrupting transmission of all forms of polio between now and 2023, and to integrate the resources devoted or for consacrer this, what do we do with the resources? We allocate them, we earmark them to combating polio in activities which strengthen community surveillance. So yeah, they talk about surveillance of polio. So that I was a bit uncertain. You do WHO, okay? A contact, a mole I have on the inside in WHO. So anyway, community surveillance. Community transfrontalier, cross-border and environmental surveillance of diseases or illnesses in general. It has also deployed teams made up of integrated public healthcare teams to intervene in other emergency situations en s'appuyant sur l'expérience, relying on the experience, drawing on experience, harnessing the experience gained during flambée outbreaks of polio, and again, tirant parti again, drawing on, making the most of the network and infrastructure of combating polio for response activities. So tirer parti and s'appuyant, kind of similar in meaning, I guess you'd say. So I like harness, right? I'm trying to use harness more today. So it's a really good word. It just gives you a sort of warm feeling inside. No one else gives a shit when you say it, but when you're interpreting, you can find a really good solution. You're like, okay, il convient de rappeler, there is a need. I always just play it very neutral. Il convient de. I try to avoid weeing, okay? So there's a need to recall that the countries of our region have taken specific steps to assurer an équilibre. Whenever I hear a balance, I always try and strike the balance between reducing the number of long-term contracts and financial obligations on the one hand, and the need to maintain key capacities by using other contractual modalities on the other. Okay, this statement suddenly veers off into the realm of administrative and budgetary activities. This would be, they'd love this kind of thing in the famous committee in New York called the ACABQ, the Advisory Committee on Administrative and Budgetary Questions. If you get a job in New York, you will be working in ACABQ. You have been warned, okay? Just take this opportunity, okay? The ACABQ, bit of a beast. It's lots of financial, lots of administrative and budgetary questions, as the title suggests. And there's nowhere you can really find stuff to practice because all their meetings are behind closed doors. And it's something of an art form. But you'll see, if you go to New York, you'll get those boys and girls. The results or the outcomes of this process sont conformes aux besoins, meet the needs or in line with the needs and program priorities of the two-stage transitional approach adopted by the region, facilitating both functional examinations and continued la poursuite des, you can say continued activities linked to polio. Capacities have been enhanced. Okay, no, they talk about capacity building, right? Capacities have been built, I suppose you could say. Somehow it sounds better when it's termed like that. Capacities have been enhanced pour mener à bien, to carry through, to implement vaccination activities and surveillance in countries affected by epidemic outbreaks due to poliovirus. Despite significant progress achieved in the African region, pockets of resistance remain. This can be, well, in English we might say this can be put down to a combination of factors. In English we just say this can be put down to a number of factors as well, including the low level of immunity of populations, poor quality and regularity of response, shortcomings at the level of human, financial and material resources. The risk of international propagation or spread of wild polio remains a global public health care emergency. And that, remember, is, I think that is used, global public health, a GPHE, I think they, in the Spanish text, I think they use that, you know. I have to double check, but I've got a feeling in the context, in this kind of meeting, that you can get away with using a GPHE. Une urgence de santé publique mondiale. That is why we must act to endiguer la maladie, to contain the illness, particularly epidemic outbreaks of, the vaccine, poliovirus dérivé de souche vaccinale dans la région. That is the vaccine-derived strain of polio. Vaccine, you don't have to say de souche, but you can just, it's called vaccine-derived polio. Okay, so very quickly, you had the wild polio. They came up with a vaccine to combat the wild polio, but the vaccine itself had a side effect that it sort of mutated the virus and created what is known as a vaccine-derived polio. I'm not going to go into the details now, just that's pretty much what the situation was. And so now a lot of them have wiped out, many countries have wiped out wild polio, but there's this vaccine-derived strain of polio that's still very much present. In the region, working to avoir la confiance, have the confidence, gain the confidence maybe of the population, in particular through information and outreach campaigns. Sensibilisation, the easiest in English is outreach. Okay, you can say awareness raising, but that's a bit of a mouthful. We will need to conduct joint interstate vaccination campaigns. The Africa region trusts that, when I hear souhaite que, I mean, it's like souhaite wishes, okay, or I mean, that's when you first hear souhaite. I wish you, je vous souhaite un bon vacances. I wish you good, happy holidays. But when it's like this, I think the safest word to go to would be to trust. The African region trusts that eradicating polio will be prioritized in national healthcare programs. To that end, member states should allocate sufficient resources to combating polio. Furthermore, in French, les vaccins anti-poliomyélite. I mean, you can just say polio vaccines. You don't have to say anti-polio vaccines. Polio vaccines should be available as part of systematic or routine vaccination, which must be stepped up, bolstered, strengthened. Our region, whenever you hear a plaidoyer, I think of advocacy. Our region advocates for sustainable integration in national healthcare programs, Okay, 1, 2, 3. National Healthcare Program of tools, knowledge, and resources used for combating polio. If I'm going fast, I hear ACTF, I'll often just skip that, right? The Africa region urges member states. I always think it's slightly better or calls on member states and invites, you could, and their partners to guarantee full financing of the base budget used by public health, integrated public health care, in order to ensure a national healthcare security and to continue to provide the technical assistance required. Okay. Required is one of those adjectives in English that you can sort of attach at the end. It's quite useful. I don't know if I've ever noticed that. You've ever noticed that, but there are certain adjectives in English that you can tag on at the end. So you don't have. It's not, obviously in English our adjectives tend to go at the beginning. In French they tend to go at the end. So sometimes, like with a required, that can actually, you can just tag that on at the end, like the French do. We urge member states to allocate affecté and make available sufficient national resources to combat. I'm doing a lot of combating, and I prefer combating than fighting. To combat various epidemics and to ensure maintained capacities and basic infrastructure geared towards eradicating polio. We urge the Global Initiative for Polio Eradication. Okay, so this is called the Global Polio. This is an acronym, actually. So it's called, what do we say? The Global Polio Eradication Initiative, to maintain its financial support to the African region in order to implement so that the ongoing implementation of programmed activities and consolidating gains. Whenever I hear a pérenniser des acquis, I kind of think consolidating gains after certification of the eradication of polio are possible. So this is a thing. Okay, they're going to talk about post-certification, basically signing off to say that polio has been eradicated. So that polio. That initiative is the GP. What is it? The G. I have to cheat by looking back at this again. The GPEI. Okay, the Global Polio Eradication Initiative is financed by a wide range of public-private donors who help meet the costs of initiatives' eradication activities. Requirements for 2019-23 are projected to be approximately $4.2 billion. Okay, so the GPEI, in case you ever come across this. It's a bit of a cheat, a bit of a shortcut. The African region, Madam Chair, African region takes note of the two reports. Thank you. Okay, moving on. So we've got a bit of the vocab now. So if you haven't tried the others, now it's good to maybe do the first one. That gives you the sort of key vocab, the key acronyms, and then then you can watch me go through that first one, right, and correct you and so on, and then you'll have the vocab when you come to doing the second, or at least you'll have some of the vocab. Okay, so this is item 14. This is Monaco. Not much polio in Monaco, I'm thinking, but never mind. Okay, now he's saying, Monsieur Président. Hang on, who's in the chair? I don't know. Mr. Chair, it's been for 20 years, the Principality, so Monaco is a Principality, has been offering political and financial support to the GPEI, so straight away, okay, here we go, the Global Initiative again, created in 1988 by Le Rotary and WHO. I don't know who Le Rotary is. I think they're called Rotary International, I guess. Rotary. I guess they're a big NGO. Rotary International, let's see, is one of the largest service organizations in the world. Stated mission is to provide services to others, promote integrity, advance world understanding, goodwill, and peace to the fellowship of business, professional, and community leaders. Glorious. Okay. Non-political, non-religious. Okay. Membership is by invitation and based on various social factors. So whoever's watching, you're probably not going to get invited, but never mind. Okay, that's Rotary for you. In 20 years, the number of cases of polio throughout the world has broadly dropped, diminué, with overall less than 1,000 children affected in 2023. Excuse me for the line that's drawn through this text. Don't know that put you off. That was my colleague who was in the meeting. Very not very considerate of him, but anyway, never mind. I'm only joking, Paul. Much remains to be done to achieve the goal of complete eradication set for 2026. En effet, never mind that. The COVID pandemic, we all know it's number 19, all right, never mind that. The COVID pandemic a démontré la fragilité. You could just play safe and just say demonstrated the fragility of progress achieved, but kind of this whenever you sort of demonstrate weakness, right? I guess it's like exposed the weakness, laid bare. Again, if you're wanting to impress yourself. Of progress achieved, the pandemic marked a serious reverse setback for action in combating polio, hindering both. Perhaps it's interrupting both vaccine campaigns and outreach. As a result, the illness remains endemic in 2 countries. The Principality, again, that's a titre, just make your life easier, just skip it. Principality encourages WHO and its partners to mobilize all efforts possible to, maybe mobiliser tous les efforts possibles, just basically means the same as do their utmost to consolidate gains on the ground. So here we go, we're preserving les acquis here. The previous one, they were pérennisés on the ground. Ensure vaccination for all remaining 0-dose children. So I guess that's a expression you come across quite a bit with this. And to enhance, bolster surveillance due to achieving a maximum of households, I guess, un maximum de foyers. The role of women who work on the ground to meet this goal is crucial. It is they who work on the front line in vaccination campaigns. It is they who, what do they do with install confiance? They instill confidence. They imbue confidence. I think instill is the best word, okay? They instill confidence and acceptance among families who are often subject to difficult economic situations and who therefore are far from considering polio prevention as a priority. We would also like to commend the efforts of these women as well as those of all agents on the ground who must act in spite of often unstable geopolitical contexts. Mr. Chair, combating polio should remain a priority of the global healthcare program, as announced during the World Health Summit. The Principality will continue to support the WHO in its work to eradicate polio, transition planning, and establishing post-certification activities. So here, this is this thing, okay, activité postérieure à la certification. I guess that's the way ahead. Once it's been eradicated, that's the next stage, post-certification. All right. And then we've got Niger. Okay, they are also going to speak on polio. Oh, all right. Polio eradication. Niger aligns with the statement delivered. I do like to deliver, obviously, don't I? I can say given, made by. It just sounds nicer if you deliver it. Statement delivered by Burkina on behalf of 47 member states, and we commend the Secretariat for including the theme of polio eradication. The governments of our countries, supported by partners, our development partners, have made substantial progress here. I know why I did that. I actually decided okay, I'm just doing this now, but I thought, okay, I'll break this up into 2 sentences. It's already, sort of quite a long sentence as it is. So I sort of skipped the pour laquelle. I could have said the inclusion of the theme of polio eradication, for which the governments of our countries, supported by development partners, have made substantial progress. But again, when you hear those pour laquelle, it gives you an opportunity perhaps to just close the first sentence down and start a new one. Say the governments of our countries supported by development partners have made substantial progress here. Niger, having signed up to the goal of eradication, has organized since 1997 interventions to provide a sustained offer of vaccines, or an offre soutenue, a sustained supply of polio vaccines. It would have been more useful if you had a couple of commas here. So Niger, which signed up to this goal of eradication, has organised since 1997 interventions for a sustained supply of polio vaccines. Just leave it out. Bolstering routine vaccination with the OPV, the oral polio vaccine. Okay, this is the new, as far as I know, the oral one that's delivered. I think you just swallow it, right? And the IPV. So this was the kind of bone of contention, because I think it's the IPV that set off the polio-derived strain of the vaccine-derived strain of polio. And in English, we actually call it the inactivated polio vaccine, IPV. So yeah, here in the French, it seems to be vaccin polio injectable. I had to do a little bit of research just there. But anyway, if you're uncertain, just call it the IPV. So OPV versus IPV. Seems the OPV is the way to go now, because that IPV was the one that was creating the vaccine-derived strain. Okay, the organisation of a number of supplementary. So I had to look up this. In fact, campagne de vaccination supplémentaire. Actually, I found on the WHO site they say supplementary immunization campaigns or supplementary immunization activities, SIAs. This seems to be the expression they seem to like. So I'm not certain what the best solution is there, actually. If you're in doubt, you just give it the full name, I suppose. I mean, you can just say if you say several supplementary vaccination campaigns, no one's going to stop me for saying that. I mean, and supporting epidemiological surveillance have allowed us to interrupt circulation or the spread of wild polio in June 2012. So just let me give you that paragraph one more time. Bolstering routine vaccination with the OPV and the IPV. The organisation of several supplementary vaccination campaigns and the support of epidemiological surveillance have allowed us to interrupt circulation of wild polio in June 2012. And don't worry if you get your present perfects and your past simples mixed up. That's the least of your problems, as I just did. Obviously, because it happened in 2012, I should have said allowed us to interrupt circulation of wild polio in June 2012. But I said have allowed us. It's never. I wonder if anyone's ever thought to themselves, "Jesus, is that wrong if I do that?" Don't worry about it. Again, OC, like starting a sentence, paras with OC. In April 2016, Niger was certified wild polio virus free, indemne free, by the WHO Regional Certification Commission. However, despite significant progress, Niger still faces the challenge of the circulation of, and very helpfully, my colleague has given us the full name here, type 2 vaccine-derived polio, PVDVC2. Crumbs. Polio vaccine-derived. No, God, I don't know. Anyway, that is the vaccine-derived strain. The response to which and the large-scale campaigns have been organised since 2021 with the NOPV2 vaccine, with more than 7 million children aged between 0 and 59 months vaccinated. Again, long sentence there. Maybe want to break it up here, which would make it that would mean it would be. However, despite significant progress, Niger still faces the challenge of the circulation of type 2 vaccine-derived polio. The response and mass campaigns have been organised since 2021 with the NOPV2 vaccine, with more than 7 million children between 0 and 59 months vaccinated. Again, you hear "don." That gives you a chance to end an old sentence, start a new one. To reach the goal of polio elimination, Niger has committed to, again, remember this is, I don't do WHO stuff, so if you hear that there's any sort of jargon that I'm saying that's maybe not right, please do indicate in the comments. I don't know if this is, can you say polio elimination, polio eradication? I noticed previously that most of them were saying polio eradication. Is that the buzzword? I ask this because, for example, when you've got poverty, you say poverty eradication. You don't say poverty elimination. So I don't know if it's a big deal here. bolstering vaccine interventions against polio and placing emphasis on populations with limited access to healthcare training. Les nomadic populations, you could probably say nomads. Transhumants. I'm wondering if it's referring to like pastoralists, okay? So transhumants, there is a word in English, transhumants, and it means basically the shepherds who take their flocks, their herds from one region to another depending on the seasons. So I've got a feeling it might refer to them, similar to nomads, maybe pastoralists. Maybe you could, just say transhumants and just leave it hanging. Populations living in deserted areas, insecurity, IDPs, refugees. So I mean, some of these things he says are specific peoples, like nomad, okay, populations, they're obviously people, but okay, insécurité, that's not a person, is it? So maybe you can just say here transhumants as an issue, as an overall issue. So populations with limited access to healthcare training, nomads, transhumants, populations living in deserted areas or desert areas, insecurity, IDPs, refugees. Establish a multisectoral approach, a multisectoral response approach. One Health. Enhance epidemiological surveillance. Remember, practice before you have a statement like this saying the word epidemiological. It's a real mouthful. Had a lot of trouble with it during COVID. At least that was one of the more minor problems I had during COVID, but still, saying epidemiological, it's a bit of a tongue twister. Enhance cross-border cooperation. With respect to transition planning for polio and post-certification activities, the the ongoing commitment, together with government, all stakeholders, and in particular religious and customary leaders, or traditional leaders, civil society, private sector, mass media, allied to effective involvement of the community, has been an important lever for the success of combating polio in Niger, stopping circulation of wild polio in 2012 and wild polio certification achieved in 2016. Long sentence, right? However, this success is jeopardized, is threatened by the persistence or by persisting circulation of vaccine-derived polio. Niger, free of polio caused by wild polio virus, must make major efforts to combat the type 2 vaccine-derived strain. That is why it is necessary to continue support transition plans, countries' transitional plans for polio eradication by 2026. In conclusion, Niger takes note of the 2 reports. Okay, so you're getting a lot of the same sort of words coming up, the same acronyms, expressions. So this is good for just expanding your knowledge, perhaps, on an issue that you may or may not run into in this kind of thing. You can run into not just the WHO, but elsewhere. Okay, and then we move on to the next subject, which is universal public healthcare. Okay, universal healthcare coverage, and we've got Niger again. So couverture sanitaire universelle, UHC, and I think in French they were calling it CSU. Okay, I can't remember what the actual agenda item was called. Is it something like reorient? Maybe it was, did they reorient healthcare systems towards primary healthcare? A resilient foundation for universal healthcare coverage. And so the statement goes as follows: Niger aligns with the statement delivered. So that's how I do it. Okay, I know some people say it aligns itself with, but I just skipped the itself. I just say Niger aligns with the statement delivered by Eswatini, formerly known as Swaziland, on behalf of 47 member states of the WHO African region on item 13.1 on UHC. By this time, you've probably had a lot of different speakers. You can just go straight to UHC. And we thank the Secretariat for the excellent report. We're going to try the more natural English-sounding version, okay? UHC means we must rethink how we invest in healthcare. In Niger, for decades, investment has been distributed based on specific illnesses, but this kind of exclusive investment is being dépassé, and my colleague has handily put in here, surpassed, exceeded in the context of UHC. The catalyst for change is our capacity to mettre en commun, to pool, I think is the best, very pithy solution here, to pool our resources to have an impact on the whole community by improving healthcare systems instead of focusing on case-by-case medical interventions. You could also say focusing on medical interventions case by case, depending on how much time you're giving the speaker, right? Unfortunately, other challenges have emerged due to the growing number of emergency healthcare situations, in particular violent conflict and natural disasters, which have led to the biggest population migrations in history, which have triggered, I guess you could also say. Moreover, populations face the spread of new pathogen agents and pathogen agents resistant to current forms of treatment. Epidemics emerging in these 10 years, or arising, I like emerging, the last 10 years, have again laid bare the vulnerability of our system and the need to redefine new strategies. I think they've laid bare the redefinition of new strategies. I think sometimes you have to think on your feet, right, and just throw in a word to give it more sense in English. Primary healthcare covers the main elements necessary to remedy these problems and improve healthcare security, in particular mobilization and education of the community. L'accent means placing the emphasis on availability of human resources, high quality medication, prescription rationnelle, maybe cost-effective prescriptions, affordable prescriptions, maybe, and a set of essential basic functions for public health, including surveillance and rapid response. Moreover, thanks to improving the healthcare system at the level of communities and healthcare structures de périphérie, do you say peripheral healthcare structures? Maybe that's peripheral healthcare structures. But I mean, if you've already leapt in and said healthcare structures in the periphery, I mean, that's one way of getting around it. Primary healthcare contributes to improving resilience. They do love that word at the UN. A fundamental key aspect, if you like, quicker to say than fundamental, for healthcare systems to resist shocks. You can just say shocks, to resist shocks, and to guarantee the continued or ongoing provision of vital healthcare services. In Niger, in the statement of general policy by the Prime Minister, des orientations. Now, when you hear that in French, you hear that a lot. Donner des orientations. I think the best solution is guidance. It can be a bit counterintuitive because it's des orientations, plural. But honestly, I think guidance, singular, is the best solution in English. Guidance has been given by the government for all actors in the Nigerian healthcare system. I think that's the adjective, Nigerian, to have a sense of absolute urgency in bolstering the resilience of the healthcare system. That's why, as part of the development the development plan, when drawing up the Healthcare and Social Development Plan 2022-26, emphasis was placed on guaranteeing high-quality healthcare access to all. Les orientations stratégiques, strategic guidance, covers the following aspects in furthering or avancer sur la voie improving or just for moving towards a healthcare system sensitive to healthcare priorities and of a UHC, remember, Universal Healthcare Coverage, which integrates the needs of vulnerable groups. Okay, we have the bullet points. Legislation to guarantee equality and une approche fondée sur les droits, a rights-based approach. That's a sort of important package. Sounds much better than if you say a approach based on rights. I mean, it's a bit of a buzz. It's a bit of a cliche. Become a bit of a cliche. A rights-based approach. Raising the voice and participation of all social sectors in defining policy. Priority to communities to better understand the needs of women and girls and to better respond to them. Mother-child healthcare services, including santé sexuelle et génésique, sexual and reproductive healthcare, okay, SRH, yeah, sexual and reproductive healthcare services, available at this is definitely abordable, an affordable price, and provided with sufficient resources. Perspectives pour les jeunes, the perspectives for youth. Une meilleure prise en compte des soins de qualité plus accessible. I had a bit of a think about this, right? When we talk about meilleure prise en compte, I think we say a greater focus on more accessible, high quality care. I don't think we talk about a better focus on. I mean, okay, you could say better reflecting high quality or more accessible high quality healthcare. But I somehow think in English we talk about placing greater emphasis on, greater focus on more accessible high quality services. In conclusion, cooperation between member states is necessary for implementation of UHC. Niger takes note of the report. I thank you. And I think this is last, but certainly not least, Mauritania, okay, on the same subject. Okay, again, we align with a statement delivered by Eswatini on behalf of 47 members of the African region. It's all the same kind of openings, all right, in these kinds of meetings. They just trip off your tongue. They just come. Shouldn't even have to think about them. Okay, it's your chance just to your warm up. This was an athletics race. It's you warming up. Right. My delegation is delivering its statement on item 13.1. My delegation thanks WHO Secretariat for its excellent report. Trotting out the same stuff, which addresses the progress towards universal healthcare coverage. Yeah, and you know what? Qui dresse l'état d'avancement des réalisations vers là. Jesus. Maybe could you just say my delegation thanks the WHO Secretariat for its excellent report on progress towards UHC. That's it. That's all you really need to say, rather than the high quality of its report, which paints a picture of the progress in achieving UHC. God, far too verbose. You could all basically boil all that down to my delegation thanks WHO Secretariat for its excellent report on progress towards UHC. You could probably even just say on UHC. At a global level, as well as challenges à relever, challenges ahead. You don't even see challenges to be met, future challenges, right? UHC remains crucial for our government. À cet égard, again, if you're going fast, drop that. Various programs have been set up to élargir, to expand, to enlarge, extend UHC to all franges de la population, okay, all fringes, all categories, all sections of the Mauritanian population. A national health care plan has been adopted for the period 2022-2030, pursuant to SDG 3, les ODD, don't forget the SDGs. Currently, the National Illness Insurance Fund, a KES, it's almost always a fund, okay? The National Illness Insurance Fund, Assure Environ, covers about 30% of the population, maybe full stop, dont 15%. 15% of this covers 100,000 needy families, subsidized, subventionné, don't say subvention, subsidized 100% by the state as part of the social program launched by the government in 2019. yeah, sometimes with these budgetary vocab, like covering, I'm trying to think if there's a better way of saying this. Currently, the National Insurance Fund covers 30% of the population, 15% of which, yeah, it's a bit, it seems to be, unless I'm reading this wrong, so the National Insurance covers 30% of the population, and 15% of that 30%, are they the 100,000 neediest families? That's how I read it. Anyway, it's a slightly awkward wording, it seems to me, but maybe, again, because I'm not French native, maybe a French native speaker can clarify exactly. Furthermore, my country has also created procédé à la création. I mean, that's a procédé, you can just skip that. You can just say created in 2022 a second insurance fund, a second insurance and healthcare solidarity fund, orienté vers, geared towards the informal sector, subsidized by over 40 million US, with the goal of bringing the rate of national coverage to 80% by 2030. À l'horizon, just by, all right? We take note of the high-level meetings which will be organized by the UN General Assembly in September 2023 pour dresser un bilan à mi-parcours. So usually when I hear dresser un bilan, usually for stock, it's usually a stock take. But when I hear dresser un bilan à mi-parcours, and especially because this is to do with the SDGs, it tends to be like a midterm review, okay? To conduct a midterm review on the SDGs, or achievement of the SDGs. Again, that's one of those sort of words that the achievement of, depending on how far behind you are, you could maybe just skip it and say for a midterm review of the SDGs since 2015, and the way tracer la voie à suivre and consider the way ahead, espérer, to trust that these meetings will allow us to take the necessary measures to allow us to move de manière significative. Okay, you can say significantly, I like saying meaningfully, to allow us to make meaningful progress towards achieving the SDGs by 2030. It's a very long sentence again. This is the sort of place where you could perhaps break it up. You know, pour tracer la voie à suivre à l'avenir, to chart out the way ahead. Sort of a slightly, is that like a naval? I mean, we do say that quite a bit in English. Okay, to chart out future actions. Okay. And then we trust that these meetings will allow us to take the necessary steps to move forward meaningfully towards achievement of the SDGs by 2030. In conclusion, we urge the WHO to provide greater support to member states to enable them to move towards UHC, the end. Okay, so there you have it, guys. So that was a bit of a deep dive into the WHO, or not really a deep dive, it was more dipping our toe into the WHO. It's always good to get, see what other organisations are talking about. If any of you guys got some interesting statements from the organisations that you work for and that you would like the Interpretation Station to break down, please feel free to send them in, and we can have a good old look at them. Guys, I hope you enjoyed that. I hope you learned some new stuff. I bet you know a bit more about polio than you did before, if nothing else. Like, share, subscribe, comment, blah, blah, blah. And that's it for today's show. And keep following me on LinkedIn. Comment, remember to comment, like comments. Okay, and with that, all that remains to be said is that episode 179 of the Interpretation Station stands adjourned.